starts with not only understanding the progression of the disease, and as I tell my patients who walk into my office, it's just the buildup of plaque and cholesterol in the pipes that feed your leg, just like it clogs up your arteries or your pipes in the kitchen sink. It can clog up your arteries in your body. So it's important that we try and prevent it from getting to a stage where we're not getting adequate, rich oxygen supply to your extremities. It's important because some of your symptoms that you might attribute to older age, such as arthritis, gout, some of these symptoms actually are that of peripheral arterial disease. This is a disease that affects an aging population, and it's very crucial that we catch it in a timely manner. And so what are some of these preventive measures? One, understanding what sugar does. Sugar is the new tobacco. It increases your rate of peripheral arterial disease 3 to 4 times faster than someone who's a non-diabetic. If you're pre-diabetic, meaning that if your sugar levels are teetering at a borderline, you need to prevent yourself from becoming a full-blown diabetic by addressing those and going to see a specialist with lifestyle changes. What you eat is very important. That is the #1 preventable cause of death, is your diet. Exercising, very important that we engage in some physical activity, but also is taking your medications. Medication adherence is very important. And as providers, we need to make sure that our patients can afford these medicines that we provide. And if they do have side effects, we need to find alternatives for these patients. Lastly, it's making sure that if you've ever had peripheral arterial disease, coronary artery disease, or a stroke, you do get screened for any of those polyvascular syndromes. For instance, if I've ever had a heart attack, I need to get screened for peripheral arterial disease. The co-prevalence is very high. It approaches 80%. So there is an 80% chance of picking that disease up early. Likewise, if you've had a stroke or if you've had significant kidney disease, you should be screened for peripheral arterial disease. So these are life-changing strategies and cost-saving strategies that we can implement upfront so as to decrease the financial and clinical burden of this disease downstream.